Okay, hi everyone. Welcome to this month's Teach Educational Rounds. We had some technical difficulties, but really appreciate everyone being patient while we sorted through that. And we are now ready to go. And here with us today, we have Dr. Trisha Tulloch, and she'll be presenting a youth vaping Q&A for us. So just for the interest of time, I'm going to go through some administrative slides, and then I'll pass it off to Dr. Tulloch to get started on her content. So to start with our land acknowledgement, CAMH is situated on lands that have been occupied by First Nations for millennia, lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. And today, Toronto is covered by Toronto Purchase Treaty Number 13 of 1805 with the Mississaugas of the Credit. And Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation and will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. And we will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. And so I'll just quickly put a link in the chat that you're welcome to use to share which lands you're joining us from today and something that you're currently doing to learn or improve your commitment to reconciliation. And I'll also just move forward with a few more announcements. And the first is that we will have our Foundational Health Educator Workshop coming up on September 18th and 19th. And this is a workshop that can be used to obtain the Certified Respiratory Educator credential or the Certified Tobacco Educator credential. And both these certifications are offered through the CNRC. So we do have that coming up, and there's a QR code and the registration link on the screen, but you're also welcome to email us at teach@camh.ca if you have any questions about that. And just a reminder that if you would like to receive a letter of completion for this Teach Educational Rounds, to make sure that you first completed the pre-learning assessment that was sent out earlier. Also to sign in using your first name and last name, and to complete the evaluation and post-learning assessment, which will both be shared with you after the webinar. And there's a few more notes to note that all Teach Educational Rounds presenters are offered an honorarium, and presentation content is not affected by acceptance of this honorarium. And a final reminder that these materials, as well as their verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. So Trish, I'll pass it on to you now. So you're welcome to get started on your presentation.
Yep. Okay, great. I'm just going to share my screen. Thanks everyone for your patience, just given the technical difficulties that we had at the beginning. So just trying to share, but I think, Rachel, you're able to stop sharing on your end. Yeah. Okay, great. Sorry, just one sec.
No worries.
You could let me know if you're able to see this screen.
Not yet, but sometimes it's now I can see it. If anyone can't see it, let us know, please. But
as I'm just making it into our presenter mode, could you just let me know if that's worked on this end?
Not yet. We can see your slides though.
Okay.
Yeah, we can see them.
Try one more time, and just if I can't, I'll just go ahead, just in the interest of time, so that we're not waiting. Rachel, could you tell me what you see on your end now?
I think it might still be loading because I don't see anything yet, but
Okay.
I know sometimes it takes a while, but I'll let you know. Now I can, it's still, it's the same, but we can see your slides. If anyone, if they look, that's better. That's perfect. Yes.
Perfect. Okay. So I just think in the interest of time, if everyone's okay, the slides, if you would like to know more in terms of my bio, feel free to maybe refer to the slides if that's okay. Just want to make sure we can get through a good chunk of this content because there were a number of really great questions. But just overall, just for everyone's knowledge in terms of who I am, I'm an adolescent medicine pediatrician in the Division of Adolescent Medicine through the Department of Pediatrics and also through the Department of Family and Community Medicine at the University of Toronto. And my roles are primarily as a staff physician, both at Sick Kids Hospital and CAMH. So just in terms of conflict of interests and declarations, here's the information that I've provided. And so we can just proceed with respect to the objectives. So we received a number of wonderful questions. I am going to do my best to go through as many of the questions provided with this overall framework in terms of reviewing the trends with respect to youth nicotine use, specifically vaping, discussing the health implications specifically related to vaping, and more of a focus on vaping nicotine, and to also look at informed interventions, so where the evidence is with respect to interventions. And also just to note that I can't share my video. Also, this is part of the technical challenges, so at the end, I'll join at the end for any additional questions. Rachel, just another housekeeping. If there are questions that pop up in the chat, I can't see those. So if you wouldn't mind just kind of pointing me to those as well.
For sure, yeah.
Thank you. So with respect to the first objective, so these were the questions that were provided to us prior to this presentation. The questions were specific to vaping as it relates to smoking among youth, the age in terms of those who we know are engaged in vaping, the reasons, the rationale as to why young people are vaping, and the reasons as to why they might seek out cessation treatment approaches, or more specifically, their reasons for quitting. So in terms of the overall global perspective, when we think about the rates, we are still among, Canadian adolescents are still among the highest e-cigarette users globally. In terms of national data, this is the data from the Canadian Student Tobacco, Alcohol and Drug Survey. And roughly 30% of students in grades 7 through 12 nationally have tried an e-cigarette, and roughly 8% are vaping nicotine daily. In terms of the Ontario data, so from our OSDIS data, so this is our Ontario Drug and Health Survey, and this is one of the longest standing, if not the longest standing survey for youth, and specifically for youth in Ontario. And the proportion of youth in grades 7 through 12 reporting past year use of e-cigarettes was 13%. It was also noted that there were a higher proportion of females, and if we looked across the grade years, we were seeing an increasing proportion of youth that were using up until grade 12. So here is the data from the 2023 year. We'll be hearing about the 2025 cohort, the last 2-year cohort in probably soon, if not the next few months. And here we can see the additional substances in terms of where vaping e-cigarette use is relative to where alcohol is still the predominant substance, or the most common substance, followed by, and really important to note, prescription opioid pain relievers, cannabis, and then you can also note that cigarette use is 3.2%, which we'll talk about in a moment. Just for everyone to just have the lens around the OSDIS data, to remember that this data is not inclusive. It excludes those young people who are in hospitals, if they're in, for example, Section 23 school, if they're in a privately funded school, those who might be in a special education classroom, those who are not attending school, those who may be involved in legal or diversion, or maybe in detention centers. So just to make sure that we're keeping that in mind as we think about these numbers provincially. So there was a question about are more youth vaping versus smoking. And so when we look at the data from the 2000 through to 2020 data, this is a combination of the Canadian Tobacco Use Monitoring Survey, the CTNS surveys of Canadian Tobacco and Nicotine Survey, as well as the Canadian Tobacco, Alcohol and Drug Survey. So we can see in blue that you're seeing a decline in terms of the proportion of young people who are reporting past 30-day cigarette use. So that's in blue. And you can see then the e-cigarette use is increasing as of 2013. And this is, again, just thinking about the cohort. So this data is specific to youth ages 15 to 19, so our older youth cohort. The data that then spans in and beyond 2020 and from the Canadian Tobacco and Nicotine Survey, if you can see, I don't know if you can see my pointer, Rachel, I don't know if that's possible to see.
I can see it. I can see it.
Great.
Yeah.
So great. So if we look at the same group, so the same cohort, 15 to 19 years of age, you can see again in blue, this is vaping in the past 30 days. So we're seeing this steady, relative higher proportion of youth in this cohort that are reporting past 30-day e-cigarette use. So this represents 30% of those ages 15 to 19 years of age who are reporting vaping or e-cigarette use relative to 10% of the youth that are reporting smoking tobacco or use of tobacco cigarettes. And then just to really highlight that you can see the change over time. So as we look at the young adult population or cohort 20 to 24 years, you're seeing that there's just a bit of it's essentially approaching where we're seeing 27% of those who are reporting smoking cigarettes, and this is the 2022 data. And really important to note that nearly half of the young adults ages 20 to 24 reporting their vaping. So just also to that question, again, just highlighting the Ontario data, relatively speaking, we're looking at 13% of grades 7 through 12 and 3% of those students who are reporting tobacco use. Also just wanted to make sure that we're highlighting the fact that 87%, so more than essentially almost the full cohort of those who are reporting that they're vaping are reporting in nicotine use. And again, this is from the OSTIS data. The second question was, at what age are young people starting to vape? So when we look at the data, most of the data captures grade 7. So grade 7 is roughly at the earliest age 12. So that would be the OSTIS data. That's our data from our STOP cohort. Health Canada reports grade 7. But what we also know is that when we speak with those who are in that younger group, so the age 12, they have, at least anecdotally, indicated that they started much earlier. So grade 6, grade 5, some report grade 4. So I think we haven't necessarily captured this data in terms of what we're seeing reported, at least from the Canadian lens, but certainly we are anecdotally acquiring this information through our clinical encounters. The third question, what is the number one reason that young people vape? So there have been a number of studies over the course of the past 5 years where we've asked this question, whether initially we looked at the US data because there was a larger proportion of youth that were surveyed, and we are seeing a similar trend with this most recent data from Health Canada, and it also correlates with the provincial data from the OSTIS study. So what's been noted from grade 7 for students who are in grade 7 through grade 12, when they're asked about the main reason for their use, they report that they are using to relax, to relieve tension, because they are, quote, addicted to vaping. They enjoy it. It feels good. They like the high from nicotine. And this is the proportion of youth who were reporting 30 days past use, so the 30%. For those who reported vaping among the youth, grade 7 through grade 12, and from the OSTIS data, majority of those youth reported that friends were the most common source of these products. And again, just wanted to highlight that almost 50% reported that their use started before in this case, grade 9. Question number 4. So what is the number one reason that young people would or endorse that they would like to quit vaping? Interestingly, from one of the studies, and this is going back to 2020, so not as recent, but 50% reported health related reasons. And the second group reported financial incentives, and social influences reportedly 10%. So this is just some of the data, but in terms of the actual reasons and factors, these are similar across the board when we look at the evidence. And overall, what is most important to note here is that it is imperative that we do delineate what those motives are, and that we incorporate that as we address the rationale or their motivation to quit or to reduce their use. These factors we know are associated with successful cessation, and they may help identify the strategies that you might incorporate as you're working with youth with respect to e-cigarette cessation. And this is from the study in 2020, Bold and colleagues, 2025. So there were additional questions related to youth engagement, communication strategies. Thought it best to actually place this here, as that is the first step in terms of being able to establish that rapport as quickly as possible in order to maintain that engagement, as that we know that there is a strong correlation with engagement and successful outcomes and prognosis. So the first question was, what are the most important points to include when discussing vaping with youth? So we go back to the motivation. So what are the reasons for that young person presenting to you? So if it's in a clinical setting, were they maybe the reason that they're there is because of a parent, because of school, because of external rationale or external factors. But maybe it might be individual. So there might be reasons that they themselves would like to explore this. And maybe they're actually coming for the reasons of the intention to treat, or their intention to work towards cessation. So we go back to those reasons, the reasons for initiation that we have from the literature. Could be that we would need to provide, or we need to understand their health-related motivations. Maybe that we can talk about how much it's actually costing a young person. So we will talk about Quash, but Quash has a way to calculate that. It's pretty accessible for youth to do that in the moment through the Quash app. We can talk about social influences, of course. And then lastly, which was captured here in this Health Canada data, is that there was also the motivation to be to not have the dependence, so not to feel that the ongoing urge to use. So speaking more again to that, described as either addiction, dependence, depending on the young person. So their reasons for seeking help, or their motivation to reduce, as we've mentioned before, this is the data that we had just reviewed. So again, really important to understand that. And then beyond that, how ready are they? So we talked about the readiness ruler in the past. I'm getting a sense of how important this is to the young person, and how ready are they to actually move forward with the steps that they've expressed that they are intending to pursue. Question number 6. So what are the most important points to include when discussing vaping? So I would absolutely highlight the importance of that initial engagement and understanding the why. Why are they here? Beyond that, ensuring that we've discussed confidentiality, just to make sure that we just address that at the beginning, and understanding who will be a part of their circle of care, who can acquire information. So understanding where consent is on the part of the young person. And so that's just a really quick summary, is the first really important pieces. Beyond that, understanding who that young person is, so acquiring all the information with respect to their identification. And then asking the details about their use. So what are they actually using? Are they vaping nicotine? Are they vaping other substances? How long have they been using? How much? How often? And when was their last use? The importance about when their last use is understanding beyond that what symptoms they may be experiencing with respect to withdrawal. And so hopefully we'll be able to get to that with some of the questions that were asked towards the end. And then going back again with respect to the rationale, reasons for using, reasons for seeking help. So here's a framework to consider. And so you'll have this slide, but there are a number of approaches that you can use as a way of creating a framework for your assessment, depending on what your context is. So you can use as little or as much of this information, but just to point out a few of the frameworks that have been embedded here. So we have the SBIRT approach. So screening, brief intervention, referral to treatment. This has been adopted across in a number of settings, not specific to vaping nicotine, but it is very appropriate here and appropriate for substance use and also appropriate for other clinical presentations. But in this setting, this is where this can be helpful, is asking questions with respect to screening, with respect to their use, assessment, and the brief intervention, specifically the incorporation of motivational interviewing and the techniques that are that allow for us to further explore the young person's the factors that they presented with. So their reasons for being present for this appointment, the reasons for wanting to quit, the reasons for ongoing use, the reasons for initiation. This is a portion of the brief intervention where you're exploring that further and you're looking for those opportunities where you may be able to shift a young person from where they may be more pre-contemplative, so not even really thinking about it as much, but now with information, they may shift to more contemplation, and then potentially even to action. So this is where that brief intervention can be specifically the focus being on motivational interviewing and the techniques that they're within to be able to support a young person with their potential change in terms of behaviors and their use. So that's SBIRT. So screening, brief intervention. The last part of SBIRT is referral to treatment. And I've referred to the Youth Fast program here in the Intrepid Lab here at CAMH. And there are a number of other programs. So just using that as an example, but the main point here is that it's beyond the screening and brief intervention that we're actually looking at what the next step looks like and arranging for that follow-up, which is part of the 5 A's. So that's another framework that can be incorporated to allow you to have a framework to be able to address the concern in a systematic way. So asking information incorporated within your screening, providing advice along the way where appropriate, and where there might be maybe an ask on the part of the young person, and then continuing with the assessment. So what I didn't highlight is the heads and shades tool. And so we'll provide those as tools that will be supplemental to this talk. But essentially, it's an additional framework that just guides you through some of the aspects of the factors that may contribute to the young person's ongoing use or initiation. So for heads, for example, we ask about what's happening within the home, education, activities related to peers, dietary concerns, and any of the risks related to their use. So I'm giving it a global overview, but the main point is that it allows you to ask about the factors that may be influencing their ongoing use. Shades is similar. It's just a spin-off of that mnemonic, focusing mainly on the young person's strengths. I'm going to pause. I recognize we don't have a ton of time, but this is a lot of information in a short period of time. We just want to make sure that if there's any clarification required here, that I can just address that in the moment.
There was one for, I think it would have been question 4. If the pie chart was showing vaping that wasn't tobacco, what substances would they be? And just clarifying if it's cannabis, it would be referring to.
Yes, that's correct. Yeah. So
Okay,
the 87% is specifically nicotine. Sorry, the 87% is nicotine. The proportion of the 13% is actually both cannabis and non-nicotine vaping.
Thank you. That was the main one in the chat, but if anyone has any questions, now is a good time.
Okay, there were a number of questions, I'll just move on, but there were a number of questions about strategies. Strategies in the context of the school setting, strategies in resource-related questions. So I sprinkled this throughout, but it really comes down to similar resources. So within so in terms of Youth Fast and our CAMH Intrepid Lab, we have a lot of information related to vaping and health-related implications, and so you can find that on our website, which has been provided here. In addition to that, Bosch, through the Lung Health Foundation, they have a full complement of resources within this category of brief conversations toolkit. I think many probably are already aware of this toolkit, but I would really point to the importance of having that structure around the types of questions and how you word questions, and this is an excellent resource for that as well. And it's for parents, it's for youth, it's for school administrators. So it really does span the providers as well as the young people that you are interacting with. In addition to that, there's additional resources through Health Canada, and then a really important resource as well is Not an Experiment. So just really wanting to make sure at least those were highlighted. I know that there's a number of additional resources that you're all aware of, but the main point is ensuring that you have a resource, one or two, that are your go-to, that allow you to facilitate questions in a way that can encourage or ensure ongoing engagement with the young person. Question number 8, how would your vaping cessation interventions differ with respect to when we compare youth compared to adults? So overall, I think we really just have to ensure that we move forward when we're working with youth and understanding that youth are not small adults. And I think that's the most important part of this, the messaging here. We can get down to the granular information and look at where we're seeing that variation, and specifically here with the Health Canada data from 2023, where we see that youth ages 50 to 19, we can see the proportion of those who are vaping as compared to those adults ages 25 and older. So roughly 6% of those 25 and older as compared to, 4% for those ages 25 and older, as compared to youth, it was roughly 14%, ages 15 to 19. And this is, again, vaping in terms of past 30 days. So really the context being here, or the importance here, is that there's a lot of developmental concerns that are developmental contextual factors that we need to consider. But the main point is that we are not looking or approaching this from youth being a smaller version of adults. And even more importantly, the majority of adults are not vaping when we look at the numbers nationally and provincially. With respect to health effects and risks, so this is a growing body of literature. What we know about the health risks, again, I've pointed to the information that we have on our nicotine dependence Intrepid Lab website. So that's a huge resource that's there that will have access to. In addition to that, there's more of the data that is coming in terms of the literature, the evidence around what is happening at the cellular level with respect to inflammation. And that is allowing for more of a better appreciation as to what we're seeing clinically. So there were some really specific questions about the clinical implications of the health risks. So I've tried my best to point to some of the literature so you would have some of these references that you can refer back to. In terms of the videos, what I was actually thinking more about when I thought about that question was, well, where are youth actually, like, where are they looking for information? And still TikTok is still the one place that I continue to hear about, and of course Instagram as well, but really social media. So finding some of these resources where you're seeing education that's being provided in a way that's helpful is a really nice opportunity where you can engage with a young person around what their understanding is as to what they've seen within social media or through their social media connections, and using that as an opportunity to engage in a dialogue with them around that information that they've actually what they've been consuming in terms of information. I also just wanted to point out a really important study. So the visual representation here is beyond compelling. And what this is a study from the London Health Sciences Roberts Research Institute. This is from Dr. Praga's lab. And what they've been looking at is a specialized imaging technique, so a specialized MRI method, where they're able to actually visualize the lung tissue, the lung parenchyma. And what they're looking at is where the distribution of the gas. So upon inhalation, where and how is the gas distributed? When they look at the comparison, so on my left, your right, for those who are non-users, so not using tobacco or vaping nicotine, as compared to those who are exclusively using nicotine-containing e-cigarettes. What they've been able to illustrate here with this very specialized technique is the degree of impairment within the airways and the tissue, secondary to what we now are really appreciating in terms of the implications of what's within the device in terms of the liquid and the other constituents, and how that promotes inflammation to the degree that we're seeing variations with respect to impairment, but certainly we're seeing this. What I can speak to even further to that is clinically, we are seeing now those who are presenting with symptoms when we do a chest x-ray, or we proceed with, for example, pulmonary function testing, we are seeing some of the effects in terms of what's sometimes defined as lung injury. Sometimes difficult to know whether it's truly correlated with their use, exclusively being vaping. However, that being said, we have studies now that are allowing for there to be further appreciation of what's happening at a cellular level. So there were additional questions, sorry, to this point around epistaxis, so bleeding, nose bleeding, nosebleeds, and so I'll just talk about that data in just a moment, but I just want to make sure that I highlight that this is also accessible and helpful to facilitate dialogue with young people as well. There was a question about how frequent we were seeing nicotine poisonings. We do have surveillance data. Unfortunately, I was only able to capture the data up until 2019, but there are ongoing studies through Health Canada and the Canadian Pediatric Society where we're looking at the number of intoxications related to nicotine. This is by far most prevalent among the younger cohort of pediatric patients, so really our toddlers and our elementary school children. However, we do still see, and anecdotally, we do hear about intoxication related to nicotine, e-cigarettes containing nicotine. Should I pause for just a moment? I realize I'm getting lots of information.
There are a few questions.
Any questions related to the health implications that I could clarify?
So someone asked if there's any evidence to benefits of group addictions counseling for youth.
Okay. So I could definitely, sorry, go ahead.
Someone asked what the name of the website that was referred to was again, but I think that should be included in the slides, or we can include that in the email that we send out.
Absolutely. We'll definitely include those references, yeah. Okay, and I'll get to the treatment approaches around the evidence in just a moment as well.
Perfect.
In terms of the next question, so this question was specific to bleeding, so nosebleeds, so epistaxis, and vaping. I could not find evidence that was very specific to this clinical presentation. I have seen this in our hospital setting. However, there was a lot of discussion with that particular case as to whether or not it was truly bleeding that was coming from the nares or if it was hemoptysis. So a young person who was actually coughing up blood that was from a hemorrhage within the lungs, and that bleeding was happening as a result of the blood that was actually sitting behind the nares or within the canal. So there is a number of studies that do highlight what is being seen in case reports specific to hemoptysis. It is a little bit tricky to have to know if this is a direct correlation with vaping nicotine, vaping cannabis, which one. However, more and more of these studies are at least allowing for there to be more consensus or compelling evidence that we are certainly seeing the hemorrhage or the potential for there being disruption with respect to at the cellular level and bleeding within the alveolar, so bleeding within the lung tissue that may result in bleeding through the nose, so epistaxis. But certainly we're seeing at least coughing up blood, so hemoptysis. Also, a very recent study from David Hammond and his colleagues just published over the last year which looked at young people across Canada, the UK, and the US. And they looked at self-reported respiratory symptoms. So I just wanted to highlight that they did see a fair proportion of those young people that were surveyed reporting respiratory symptoms over the past week when they were exclusively vaping. So 30% reported symptoms, specifically cough, shortness of breath, chest pain, and wheezing. And I didn't see a large proportion or significant number related to hemoptysis or bleeding. The next question was, what does the current body of evidence suggest regarding youth vaping leading to future smoking? So there's certainly increasing numbers of studies that are looking at this association. We know, again, that it's sometimes hard to tease out that exclusive group that vaping exclusively versus those who may be vaping and using tobacco, vaping and using cannabis, etc. So there really, at this point, isn't consensus, but just wanted to kind of go back to the original discussion that we were having, the questions that were asked around comparing youth versus adults. Smoking versus vaping among youth, we still know that the majority of youth, if they are using nicotine or consuming nicotine, it's a majority of them are vaping nicotine as opposed to smoking cigarettes. So I think I would say there will be more of this data that will come, and I think it will help for us in terms of informing our approach with respect to our cessation strategies. So the last bulk of the questions were specific to nicotine in terms of dosing NRT, and looking at that comparison. We think about that one-to-one that we often talk about when we're comparing cigarettes to nicotine, and we're thinking about dosing the nicotine replacement therapy in that way. So I just wanted to go back to where we kind of typically start when we're thinking about, or when we have been thinking about that comparison. A lot of the data that came from Stanford, for example, and a number of other institutions looked at making this comparison for the purposes of understanding the amount, the degree or the severity with respect to nicotine exposure. What we now know, and again, more and more evidence, and we did have a bit of a sense of this, but didn't necessarily have all of the evidence there to at least support next steps. But we do know that when we look at the devices, so the e-liquid within the e-cigarettes, that it's variable. And it's challenging to really know how much a young person is exposed to. So the amount is variable depending on the actual device itself, or the liquid within the device. And then beyond that, what is the young person exposed to? So some of the data that is, this is from 2022, that this particular study looked at a number of disposable e-cigarettes, and they compared the amount within the actual e-cigarette itself in terms of the e-liquid to what was reported on the label, for example. And also where they really were looking at is the discordance between, the label itself, so the nicotine content that was labeled, and the actual nicotine that was measured. And so you could see there were quite a number of discordances in terms of a larger proportion of discordance between the label itself and the amount. And so those are the ones that are at the top of this graph. When we take this a step further, so if the label it doesn't correspond, and there's a few additional studies that corroborate this as well. That's right, I'm just going to pause there. There's now more information about how we might be able to isolate with serum and urine samples the youth that are exclusively vaping nicotine. And so there are a few more recent studies that look at a bit of an algorithm with respect to what nicotine metabolites could be tested within the serum and urine to get a better sense of those who are essentially non-tobacco users. And from that information, being able to ideally isolate and have a better sense of which young people are exclusively using nicotine, and being able to then take that information to potentially quantify the amount of nicotine. So this information is there's more and more of this data, specifically looking at cotinine levels, and there's a number of other metabolites. I didn't include that just for the sake of not making this too complicated, but just to maybe be aware that the idea of comparing what's within the serum and urine and then comparing that to the device itself, so what's labeled and what the amount that's of nicotine that's actually within the device, this is where we're heading in terms of getting a better sense really of how much is being used. How practical this is, not so much. So, it's important information, but from a practical sense, how do you know how much you should be using in terms of replacement is really what it comes down to. And what I'm going to suggest is, yes, it's important to understand to the best of your ability what that conversion is. And we've talked about this calculation in previous during previous webinars. So understanding that it isn't one-to-one, but doing our best to get a sense of the amount that the young person is using, particularly when they're using the higher percentages. So the 5% nicotine-containing e-cigarettes, which they're still able to acquire. Having a sense around those numbers, and then being able to do the assessment in a way that you understand what their symptoms are as they relate to when they aren't using. Are they experiencing withdrawal symptoms? So we talk about cessation support, and that's where we're moving towards. And some of the questions that were asked is, how important is nicotine replacement therapy in terms of being able to support a young person with respect to successfully quitting? So where I would just point everyone to think about is that, yes, it can be important to ensure that this is part of the plan, particularly if it's interfering with the young person's ability to, for example, remain in a classroom setting where they do not have access to the nicotine through their vape, but then because of the degree of their use disorder, their dependence, they are unable to actually engage in their academic in their classroom, in the work that's happening within the classroom setting. So using that in that setting where it's impairing a young person's function. So in this case, the example is functionally within the school setting, where you could use nicotine replacement to ensure that they're able to get through the day without the need to leave the classroom to use their device, or without the need to pull their device out, and try to be discreet about using it within a classroom setting, which we're all aware that this does happen. So that's an example. We also see this in the hospital setting, where a young person comes in there in the emergency department for a lengthy period of time. They are unable to leave the emergency department for a number of the reasons clinically, but because they've been using a large proportion of nicotine or consuming this through their e-cigarette, they start to develop withdrawal symptoms. And in those settings, it is imperative that we understand that this is part of their clinical picture and ensure that we're treating the withdrawal symptoms appropriately. So those are two examples of where the importance is in terms of nicotine replacement therapy. So specifically speaking about short-acting nicotine in terms of the gum, the patch, the gum, the lozenge, the inhaler, and then long-acting in terms of the patch. And there is enough evidence to support the use. So the second question was, how do we address this with adolescents who are using nicotine, given that they're in terms of labeling, there's restrictions for those who specific to prescribing NRT for those who are 18 and older. So I just want to highlight that there are lots of medications, almost 80% of the medications for pediatric patients, where we're using medications off-label. So we often have this paucity of or lack of data to support the use of medications, mainly because of the ethics concerning testing within our pediatric populations. So I would really want to continue to encourage that if there's an indication that we are prescribing accordingly, irrespective of age. And we've provided the resources there to support those who might be a bit apprehensive or would like to understand that a bit further. So lastly, in terms of the practical strategies. So when we, again, address the indication for nicotine replacement therapy, we've talked about this idea of estimating. So with that calculation, getting a sense of what their use is per day. I didn't go through the calculation just in the interest of time, but having a sense of where this is with respect to the number of cigarettes for the purpose of at least starting somewhere in terms of nicotine replacement therapy from a treatment standpoint. But more importantly, is the young person symptomatic? And what are the targets with respect to alleviating the symptoms that we're trying to address? And then the context. So we talked about the school as an example, as a setting, and we also addressing, for example, if it's in a hospital setting, but there's a number of other examples I think we can all think about where this would be appropriate. So this is the practical aspect of it, is ensuring that that assessment is all-encompassing in terms of these contextual factors. And then just remembering that the nicotine within the e-cigarette, we know from the data that it's variable. So we're not necessarily certain that that's the amount that they're actually exposed to. So we do need to ensure ongoing follow-up to ensure that we're addressing those symptoms. Start low and titrate to manage those withdrawal symptoms and ensure that we're addressing the symptoms and the severity of the cravings that the young person may be reporting. And so lastly, just making sure that we offer the information here with respect to the support from a number of pediatric organizations and a number of societies, just to ensure, again, that I'm kind of bringing home that message around it's not about the age, it's about the clinical presentation. And this is a similar slide. The final point was just going back to the practical strategies, so you'll have this information and the resources that were mentioned. And then I always talk about this multi-pronged approach. So someone asked about groups, thinking about what is on the kind of essentially the menu, but where is the young person? Are they interested in group therapy as being part of the treatment plan? So this slide really allows for you to think about the kind of essentially the larger context. What else is driving their symptoms in terms of concurrent mental health disorders that may actually explain or allow for there to be some understanding or appreciation as to why they're continuing to use or why they've initiated use. Ensuring that we're providing education, ensuring that we're allowing there to be individual therapy as well as group therapeutic interventions. And then this is a list of the behavioral interventions. We've already addressed the nicotine replacement therapy as being part of the pharmacotherapy. And there are a few other additional considerations, but really for the purposes of addressing withdrawal, nicotine replacement therapy would be the standard of care. And in addition to that, thinking about how you utilize or incorporate the medication component with all of the other aspects to care. The evidence is more than compelling that it is about the therapeutic intervention. That is the standard of care that is consistently found within the literature. In addition to that, looking at where parents, caregivers, supports can allow for there to be additional support for the young person. And it may be that you're providing support for the parent or guardian separate to the support that's being provided for the young person. Maybe there's a parent group that they can join, providing education for the parents or the caregivers, but ensuring that we're not forgetting about parents as part of the bigger picture. And then ensuring that we've addressed harm reduction. And talking about that is a full other discussion point, but I just want to make sure that that's highlighted as part of the larger plan. So I won't have the time to go through prevention and policy, but I will at least point out that there are those tools or those resources that we've provided, a lot of information that's specific to this, the questions that were asked around prevention within the QUASH resources, the resources through our CAMH website, Not an Experiment, as well as Health Canada, the Health Canada resource. And I'll just stop there. Again, we do apologize about the delay, but that's where we'll land for this afternoon. And I'm happy to grab questions too.
I'll put also, yeah, if anyone needs to leave at this point, we completely understand. Thank you again. As Trish said, we did have some technical difficulties, but everyone was very patient. So just want to say thank you for that and thank you for joining. I will put, I don't know, I'll put Trisha's email in the chat if anyone did have questions. But I can tell you, Trish, I think you answered a lot of them.
Oh, good. Okay, that's great. Okay.
Yeah, I noticed that. Yeah, but if anything else comes up, then you're welcome to send an email. Also, I'll include it in the end of webinar email that I send out to everyone. But I'm just going to keep going with a few end of webinar items. But again, if anyone has to leave at this point, thank you a lot. Thank you, Trish. That was a very engaging and informative webinar. So we appreciate you joining. But just a couple of reminders that, again, if you did want to receive a letter of completion for this Teach Educational Rounds, to make sure that you complete the post-learning assessment and evaluation that will be sent out. And again, if you join the webinar using a different name, just send us an email and let us know about that too. And also, we do have some upcoming webinars. We have two actually in August. We have one next week on August 6th. And that will be on, that will be a special tour. It won't be accredited, but it will be a special tour on, let me actually just show you on the slides, youth retailers and the tobacco endgame, and we'll be with Dr. Megan Roberts. So I'm excited about that one. And then we will have a second Teach Educational Rounds, our standard one, and that will be on August 20th, and that will be on nicotine dependence with older adults with Dr. Aviva Rostis and Marilyn White Campbell. So that registration for the second one will be opening soon, and registration for the one next week is already open, and that will also be included in the end of webinar email. And then just a reminder that if you missed a portion of today's webinar or want to view it again or see any of our previous Teach Educational webinars, we do have an archive list. And for now, thank you. Thank you everyone for joining. Thank you, Trish, for presenting with us today. And I hope everyone enjoys the rest of their afternoon.